Anneliese Dressel, our nutritional therapist of Times Square, Ballincollig, joins me. Good afternoon to you, Anneliese.
Hello, Patricia.
Pushing up the wrong fader. You're very welcome. Okay, lots of questions. Let me get straight into questions. Still, again, a week doesn't go by that we don't have somebody who's still suffering some kind of effects of COVID. This is a listener to say, hi, I had COVID, which developed into pneumonia, so I was really, really unwell because of COVID. Could Anneliese now recommend, please, a probiotic or maybe a pick-me-up to get me back on my feet again? I'm currently taking an aspirin, a statin and a blood pressure tablet, but nothing else, but just still feels down following COVID, which led to pneumonia. So somebody who was very unwell from COVID.
Yeah, and long COVID is really, really common, Patricia. A lot of people eat. And the strange thing about COVID as well is that for a lot of people who have long COVID, they weren't actually particularly sick with the virus either. So it's a very, very, very strange virus and a kind of a frightening one, really. So different things have worked for our customers with long COVID, but fatigue is a very common side effect. Also, a lot of people have respiratory issues. Their breathing isn't right. Some people have developed sinusitis. A lot of people have actually strange rashes, sleeping issues, brain fog, not being able to think or remembering things. They would all be very, very common causes. So there's different approaches will work for different people. And in this case here, I think because of the pneumonia, there would have been a lot of antibiotics used as well. So a probiotic is always a good one. And I think when you're choosing a probiotic after an antibiotic, go for one that has a lot of different strains in there. So Biokult is a nice sort of cheap and cheerful one. Actually, it's, when I say cheap and cheerful, it's not that it's very cheap, but it's very good value for what you're getting. There's 14 different strains in there. Nature's Plus do one called Immune Microbiome, and that's got 18 different strains in there. And also Udo's is always a big favourite with our customers as well, the Udo Super 8. So that will help with your immune system in a roundabout way and help with your energy in a roundabout way, but it will take a month or two for that to kick in. So in the interim period, I would recommend something like a tonic like Source of Life Gold. That's very good just as a general pick-me-up. There's stuff in there for the immune system and for energy. For people who are really, really struggling with energy, taking one of the B vitamins called niacin every 2 hours throughout the day can help. So you can try that. Now, there's different types of niacin you can get, Patricia. Some of them cause a flush and they make your face look like you've had the worst case of sunburn ever, and you get a tingling, pins and needles all over your whole body. So it's probably better to go for the no-flush niacin and take that every 2 hours throughout the day. And then if your chest is struggling, we've been recommending either the Dr Clare, she does the Mucotone, which is very good, but she's actually also got a Covitone blend that is better for people who've had COVID and may not necessarily have an infection. So that's Dr. Clare's Covitone. And then finally, olive leaf extract is always one of our favourites after any type of virus or surgery or anything at all that has affected your immune system. I always feel great when I take it myself. I get a great feeling of vitality, and it's best to take that in liquid form if you can.
Okay, then there's a number of people have kind of lingering coughs, and let me bunch these together. Somebody said I had a very bad flu. It's about 3 weeks ago, but I still have the cough. I'm still suffering from a sore throat. I have taken antibiotics. I have been on a steroid, but I'm left with this cough and this sore throat. And somebody else that thankfully never had COVID, but I have this really bad cough, and I always seem to be coughing at night time. So kind of lingering coughs.
Well, actually, nighttime is a very common one to feel worse at night. Asthma, all of these inflammatory conditions actually get worse at nighttime. So most people who have a cough and a cold will notice that they cough way more at night. But also, should say, Patricia, another red flag for me is people who don't have a cough during the day and start to cough at night, because that to me is more acid reflux, because when people lie down, the acid starts to leak up from the stomach and catches the breath, causing a very kind of a dry cough. So that's a question I always ask people if they cough a lot at night is, do you have problems with your stomach? So rule that one out. But the lingering cough, I had it years ago, Patricia, and they called it the 100-day cough at the time. So it was a particularly nasty cough and cold virus that just wouldn't leave. So I would definitely recommend something like a natural cough bottle that has either marshmallow or mullein in there, because both of those are very soothing and nourishing for the dry and irritated respiratory tissue that when you breathe, if it's irritated, gets caught, and then you end up being irritated and coughing. So, like, there's a couple of different ones. The Irish Botanica is a very good one. There used to be a great range of the Comvita ones. Unfortunately, they haven't been available for a while. We have a mullein syrup here, which is actually I've managed to finally track down through a Polish supplier. That's really, really good for dry, irritating cough. And then the Dr Clare, she does a throat spray that has got marshmallow in it. So, and there's also sage and echinacea for the sore throat. So I think taking something like that to stop your cough when you start coughing is very good. And then take an immune booster besides that, just to give your own body the best fighting chance. So the immune boosters we love here would either be, there's a Dr Clare, she does an Immitone that is fantastic. Also, actually, that Mucotone is another very good one that Dr Clare does. If you can't get your hands on that, you could try just plain echinacea, maybe an ivy and thyme from your local health store. And then make sure you're taking vitamin D, C and zinc. And I also love the beta-glucans, which are brilliant for giving you a good immune boost. And Nature's Plus do a lovely immune boost complex. That's very good. And then again, of course, the olive leaf extract. So pick and choose from those depending on your symptoms, whether it's dry, mucousy, but definitely support the immune system along with the cough bottle as well.
Here's another strange one as a direct result of COVID. Could you ask Anneliese, please, what would she recommend for hay fever? I've developed hay fever since I got COVID, not on any other medication. Never had hay fever before, but this listener reckons it's directly linked to getting COVID.
Absolutely. And in actual fact, this was I've been doing a huge amount of research, Patricia, and trying to do training and learning around long COVID because I'm seeing so much of it and trying to help people, and we really don't understand it. But one of the earliest natural approaches was that it was likened to what we call mast cell activation syndrome, MCAS. Mast cell activation syndrome is where your mast cells, which hold histamine in your body, are consistently being degranulated. So they're basically being exploded and releasing all this histamine. And long COVID is one of the symptoms of that is very, very similar to what is formerly known as mast cell activation syndrome. So we work on the same basis that it's similar to that. So in this case, I would recommend taking quercetin is probably the most important one. It comes in a complex. You can get it either with beef or stinging nettle. There's various different ones. Mucotone, the Irish company, actually do lovely quercetin complex. So you need to take that at least 3 times a day. I'd also recommend taking a vitamin C high dose. The Somega, they do a lovely liposomal vitamin C, which is really, really easy to take, and it's very, very good quality one. So the vitamin C will definitely get into your cells. The other thing that's absolutely crucial is something called N-acetylcysteine, or NAC. You should be able to get that in any health shop as well. So add that one as well. And if you are then noticing that you're very, very bad when you eat different foods, which for some people that can happen, the mast cell activation, you can buy an enzyme online called DAO. We don't stock it here in Ireland, so you have to buy it online. And it basically helps to break down histamine after you eat. So you'd normally take it if you go out. It's expensive, but it works brilliantly, and that's called DAO.
Okay, all right. Here's Anya. Hi. Could Anneliese please recommend best supplements for a boy doing leaving cert, having problems with study and retaining information, and he needs to be able to have clarity. He is on a good fish oil at the moment. Is there anything else you would recommend?
Definitely, Patricia, because it's trying to not only just be able to sit down and study and focus and concentrate. Retention is very important as well. So the fish oil has the retention bit covered. They take time to kick in. So people who are doing exams in sort of May, June need to start taking a fish oil right now. And I would take one with a high DHA content in there, because that's the bit. Normally a fish oil comes with EPA and DHA. DHA is the one that you want for the brain. So there's a couple of different things that could help in this case. There is a very good supplement called Mastermind, which is made by the Irish company Revive Active, who do the Revive Active and amongst other things. And that can really help with focus and concentration in the long term. So that could be another one to add. And then one of my favourites is L-theanine. So L-theanine works in the moment. It doesn't have any long-term benefit, unlike maybe the mastermind and the fish oil. But in the moment, it promotes our ability to be focused, to be motivated, and to be calm. So much so that people actually take it at night to stop the busy body, busy brain. And actually, I recommend it a lot to our customers, Patricia, with kids that have ADHD, because it does help them focus and concentrate more in school. And you can take L-theanine 2 or 3 times a day, no problem. And there's a couple of different brands. Again, that Irish company, Mucotone, they do a lovely L-theanine brand, and also Viridian have a very, very strong one, which has got lemon balm in there as well. So any of those would work.
Okay, you mentioned olive leaf extract a couple of minutes ago. Somebody said, I've been taking olive leaf extract and I didn't realise it's meant to be kept in the fridge once opened. It's been open now since before Christmas. Is it still okay to take?
It'll be fine, Patricia. I'd say you might have lost a little bit of the efficacy of it, but it'll be absolutely fine and it'll still work.
Okay, and very quickly, could Anneliese help, please? I've got pain and burning when I go to the toilet when I'm urinating, and then it can last for about 5 minutes afterwards. I haven't got an infection. It's been going on for a year or more.
Okay, so I don't know if this is a man or a woman, Patricia.
A woman, I think, by the picture.
Yeah.
I'm thinking
so
could be.
I presume at this point they've been to the doctor and they've ruled out
kidney infection.
They've ruled out a kidney infection or a bladder infection. So there is also something that affects the bladder and the urinary tract called cystitis, and that is not an infection. Now, there's 2 kinds of cystitis. Some people will develop cystitis maybe around the time of their period, or if they eat certain foods, or if they maybe after intercourse, or if they do very aggressive sports, because it causes bruising to the urethra and the tissue. So if it's that, I would definitely recommend something like Cystone by Dr. Clare and D. Manos. So the Cystone is a blend of different herbs that Dr. Clare has put together, and they're very good to nourish and keep that tissue very healthy, so it's less likely to become damaged and cause those kind of problems. D. Manos then is another lovely one to take at the same time, because it just makes sure that there are no bacteria that could be, even there at a low level that mightn't be at infectious level, but that could be causing those tissues to become damaged. And then I think, again, if there's any type of menopause, the tissue can be very, very dry, and therefore, again, can become damaged easily. So always the omega-7 are absolutely lovely for that. Vitamin A and vitamin E you can get from nuts, seeds, avocados. Have a tablespoon of good quality olive oil every single day. That'll put the fats in from the inside. And then the omega-7, which normally comes from buckthorn. So that would be that one. There is one other one as well, Patricia, which is called interstitial cystitis, and that one is a very, very difficult one to get a handle on, because it's basically where bacteria are in between the tissues at low levels and cause a constant type of inflammation that will create that kind of burning sensation. But if you've got that, you're going to need to go to a nutritional therapist or a practitioner or a doctor that specialises in that area, because it takes a bit of work to get that one right.
All right, a mine of information as always, Anneliese. Thank you for that. Have a lovely week. We'll chat again next week. That is Anneliese Dressel, Health Hub, Times Square in Ballincollig. She has a great website, healthhubstore.com, and she'll put up all the information that we spoke about as heard on the radio, and she'll put that up this afternoon. And John Paul will also put up Anneliese's slot today as a separate podcast that goes up wherever you get your podcasts from later on this afternoon.